I didn't get involved in practice-based research because I believed in it. I got involved because I didn't believe in it. I was a skeptic. I thought, okay, an insurance company or a government is going to shove this down our throat. I didn't need to know what's going on. And so I got involved out of sheer skepticism, and I said, I'm going to see what they're trying to shove down my throat. And literally went a complete turnaround. I was converted. I became an advocate. I believe the whole premise of practice-based research is your dentistry, my dentistry, will improve patient care in the future. It's not claims data, it's not insurance data, it's not government data, it's your data. It's your dentistry. That's what converted me. Plus, serving on the EC, trying to vote on a study, I was never lobbied by anybody to have a study, be passed or denied, in the sense of, and I'm just a rum-dum like everybody else in private practice. Why would they give me that much independence? Why wouldn't somebody try to lobby me or try to influence me? No influence whatsoever. So that independence, the idea that somebody would ask me, me a clinician, what to do my dentistry, to be part of that network, to be part of that study, that's cool. And you all have this opportunity. You all have the opportunity to contribute by using. So all of a sudden it questions everything you did. The simple stuff you do every day, all of a sudden you go, should I be doing this? And this is healthy. Healthy because all of a sudden you're more amenable to change. And if your goal is to make patient care better, hey, this is cool. You become a better dentist, and you're hopefully providing better care to your patients. I said that I thought I became more competent. And somebody challenged me on that in the audience, and they said, well, how do you know you're competent? And I thought, wow, that's a great question that I can't answer. And so I did my research. I started figuring out how do we measure competency in yourself, how do you measure competency in others, and this type of thing. And one of the ironic thing about competency is the study says those people who worry about their being competent are the most competent, and those who think they're competent are the least competent. So the person with the chip on their shoulder, look out. Anyway, the academia world is open to us, and we're afraid to even just access it. But through the practice-based research, these people are willing to share great information, what their belief system is, and should we fund this study or not fund this study, and that type of thing. So now I believe in the ferrule. If I can get more ferrule on that tooth, I know my endodontically treated teeth are going to be successful, and they'll make the endodontist happy. So you learn from actually just even vetting studies, and I think that's one of the things that Brad Rendell and myself, and hopefully even kind of a study club aspect of it, is that we can have a group here in Minnesota who can vet studies before we take it to the EC, because one of the things that happens at the EC, if the presentation is not clinically relevant, or it doesn't feel like it's a good thing to change dentistry, it's not going to get funded. And so that vetting process is actually fun because of the fact of the matter is you're rethinking that clinical question and getting different vantage points. An endodontist will have a different viewpoint than I will, and a prosthodontist will have a different viewpoint, and that type of thing. So it gets you exposed to a lot of different thought processes. One of the things you start realizing is when you have access to experts throughout the country with different opinions, you got access to a lot more critical thinkers, and people will share their perspective of new technology or new instruments, their use and their benefit from. I mean, I'm all of a sudden, I have this weird thought processes that I never had until I got involved in practice-based research. And so you start questioning really what you do every day, which is healthy. I honestly think it's a healthy side effect of practice-based research. And I think that's what evidence-based dentistry is. It's making us look, okay? I have this question, I have this place, this website that I can now go look and see what evidence is out there. I'd say that the downside of evidence-based dentistry is why we're here. There isn't a lot of good evidence out there on a lot of the procedures we do. So that's what this network is doing. It's producing that evidence. We're going to have, you and I can produce that evidence, so we'll have a place to look. That's the value of practice-based research. I felt like we all walked in there with a kind of a chip on our shoulders, and I think we all walked out holding hands singing Kumbaya. Let's improve patient care. And really, that was the motivation that everybody was there. How do we improve patient care? And so that's, in my opinion, what practice-based research is about, because it is real dentists, real people, real dentistry, and trying to measure that and move that forward.